Hello, my name is Dr. Stephen Liu, Director of Thoracic Oncology at Georgetown University. At ASCO 2025, we do expect to see results from some practice-changing studies and a lot of practice-informing studies. I think it's a big year for lung cancer at ASCO 2025, and two of the biggest stories, I think, are going to be in small cell lung cancer. We'll see in small cell the results from the IMFORTE trial. This was a phase 3 study. It will be presented by Dr. Luis Paz-Ares from Madrid, Spain. This was a study looking at maintenance lurbinectedin, and we know from press release that that did improve progression-free survival and overall survival. This is a study where patients with small cell lung cancer receive first-line carboplatin, etoposide, and atezolizumab, and then are randomized to atezolizumab maintenance or atezolizumab plus lurbinectedin. And we know that lurbinectedin improved PFS and OS. We don't know is how much did it improve OS. We'll learn that at ASCO 2025. We'll see the toxicity. We'll see the full data set and see how this could inform practice for patients with small cell lung cancer. An important strategy because, as we know, 50% of people never receive second-line treatment. Really waiting until progression carries some degree of risk due to the attrition in small cell lung cancer. In that second-line setting, though, our current standards include tarlatamab, lurbinectedin, topotecan, platinum retreatment. Dr. Charles Rudin will present the data from the randomized study looking at second-line tarlatamab versus chemotherapy, another positive trial that we will see at ASCO 2025. And so, again, the details are going to be very important. Look forward to seeing those results in small cell lung cancer. In non-small cell lung cancer, we'll have some important updates. I'm looking forward to seeing the results from the first-line study of datopotamab plus pembrolizumab plus or minus platinum. That'll be presented by Dr. Ben Levy. We're looking to see the impact of using a TROP2 ADC in the frontline setting with immunotherapy. Early results did show very encouraging response rates. Let's see how those mature. Let's get a closer look at toxicity and durability of those initial responses. So I'm looking forward to seeing those data to see if these drugs are going to play an impact or have an impact in the frontline setting. And then certainly in the targeted therapy setting, we're looking at zipalertinib data with or without amivantamab and exon 20 EGFR mutant lung cancer. That'll be shared with Dr. Helena Yu. We're going to see some updates of an important study of patritumab deruxtecan in EGFR mutant lung cancer after TKI. And so this is an ADC that we think may be able to replace second-line chemotherapy. Tony Mock will present those data. We'll also see sacituzumab govitecan, the other TROP2 ADC in EGFR mutant lung cancer. Is it going to show the similar data that we saw with datopotamab and TROPION-Lung05? For HER2 mutant lung cancer, an important update from BAY 2927088 from our colleague, Dr. Herbert Leung. We've seen data from zongertinib at AACR. Here we'll see the other HER2 TKI. Look at that toxicity data, look at those efficacy data to see if this is going to be another promising agent in that setting. Some updates on KRAS G12C are going to be expected. Adagrasib and pembrolizumab in the frontline setting. That combination, is it tolerable? Is it effective? Dr. Passiani will present some of those data. And I think a big story will be in the early stage resectable lung cancer. We are finally going to see the overall survival data from Checkmate 816. This study presented by Dr. Patrick Ford, we know adding nivolumab to neoadjuvant chemotherapy improved PCR, improved event-free survival. Here we see the data improving overall survival. We know it's positive by press release, but we need to see these data. We'll also see some important updates on Aegean, looking at ctDNA dynamics from Martin Rec. And we'll get an update on Checkmate 77T, that study looking at perioperative nivolumab. We'll hopefully see some mature data from that trial from Dr. Mariano Provencio. Of course, one of the bigger studies, of course, will be Dr. Jamie Chaft presenting the NeoAdora data, this neoadjuvant osimertinib for early stage EGFR mutant lung cancer. What is the benefit, the impact of osimertinib in that setting? So I think a lot of impactful data, some rich data sets to go through. We have a lot to talk about after ASCO 2025.